So, the one thing that I'd like to clarify is what happens during a psychiatric evaluation. I get patients who come in and they're usually very nervous. And I have to remind them right off the bat that this is not a judgment. There aren't any right or wrong answers. It's just me collecting information. And that's really what a psychiatric evaluation is. We're collecting information about your social history, about what type of work you do, where do you live, are you married, do you have children. I use all of this information to make a whole host of decisions. And often I get patients who come in and they have the expectation, either from seeing other providers or going to other appointments, where they think everything is going to happen in one appointment. And sometimes it does. If we're able to get it done in one appointment, we're able to get things done and collect all of that information in one appointment. But oftentimes I find that I need to reschedule patients once, maybe even twice, to be able to get all of that information. Because the last thing that I want to do is rush that process. That initial psychiatric evaluation, I'm doing a lot of different things. I'm also trying to make the patient comfortable with me because I'm asking a lot of questions. You've known me for 15, 20 minutes and I'm like, "Hey, are you sexually active?" And it's like, "All right, wait a minute now. Let's get to know each other a little bit." So, I'm doing a lot of different things in that appointment. I'm educating the patient. I'm finding out who they've seen before. I'm getting an idea of what their idea of what they're expecting to get out of this psychiatric evaluation, what they think is going to happen afterwards, what are the next steps. Sometimes that's the time I'm taking to educate them on, okay, well, this is what's going to happen next, and so on and so forth. So in the cases where we have to do 1 and 2 and 3 appointments, we're taking our time, we're going through medical history. There's a lot of patients who have seen a lot of different psychiatric providers. They've tried a lot of different medications. I like to take my time. How long were you taking that medication? How did you feel when you were taking that medication? Did you experience side effects? Was it effective for a short period of time and then you found that it stopped working? Were you taking any other non-psychiatric medications during that time? Were you taking medication for your allergies? Were you taking anti-seizure medications? Were you taking bipolar medications? Were you taking hypertensives? All of that information helps me to then, when we get to the end of the psychiatric evaluation, that's when myself and the patient create a treatment plan. And the treatment plan is really when the work starts, because that's when together we're deciding. The patient is saying, "Listen, Sheila, this is what I'm coming here to do." And it's usually a question that I ask towards the end of my psychiatric evaluation. Like, "Okay, you've come to see me. What is your goal? What do you want to get out of being in psychiatric care? What are you looking for?" And that becomes part of the treatment plan. Common answers that I get: "I can't sleep. I don't want to be so anxious. I can't focus and concentrate. My emotions are all over the place. I want to be able to just be calm and go through one thought at a time instead of having these thoughts that are racing through my mind and I don't even get a chance to catch one of them to even work through the thought to even make a decision." So then that's when our treatment plan comes together. For me, that's the fun because those are the goals. That's what I know that we need to work on. And then those are the different areas that I can see where my patient might need more patient education, or sometimes even where my patient might need to be referred out, whether it's to their gynecologist, whether it's back to their PCP. Like, "Okay, we're talking about fatigue. When's the last time you had blood work done? Your thyroid, hemoglobin A1C. When's the last time we looked at, all of your blood work to see what else might be going on?" Again, that's when I like to know, what type of work do you do? I see a lot of people who work in the medical community, in our hospitals, EMT workers, nurses, doctors, residents, and those people are known to work all types of crazy hours, 12-hour shifts, 10-hour shifts, back to back to back. So when those people are coming in and we're talking about fatigue and things of that nature, that also brings up nutrition. Okay, what are you doing to fuel your body as you're taking care of others? What are you doing to build yourself back up so you can go back out there and take care of others? I usually like to reassure my patients that during the psychiatric evaluation, it's not an interrogation. There are no right or wrong answers. This is the time for us to be able to together get as much information out there so that we can kind of create an overall picture. And creating that picture isn't just about mental health, it's about physical health as well. It's about lifestyle. So when we get to the treatment plan, a lot of times the treatment plan include things that sometimes patients are not expecting when we're focusing on sleep hygiene. I will often have patients remove televisions from their bedroom. I will have them create a sleep schedule so that they're doing the same thing every single night so that we can get them back into a pattern of regular sleep. Sometimes we have to get creative with that for patients who have schedules that are constantly ebbing and flowing and moving, to kind of teach them how to, no matter where they are, whether they're traveling, East Coast, West Coast, day shift, night shift, evening, how they can continue to create a space for them to be able to get a good night's rest so that they can allow the body to do what it naturally wants to do, which is to, rejuvenate and heal itself to get ready to go back out there to do what we all do. I like to remind patients that there's really no topics that are off limits. And like I said, there's no right or wrong answers. The more information my patients are able to share with me, then I know that even if it's something, I'm not a jack of all trades, I don't specialize in everything, but what I do try to specialize in is knowing where to refer my patients to. And therapy is often a big piece of that. Often patients think of, especially when they're at the point where they're overwhelmed with racing thoughts and insomnia and all of these different symptoms, they become symptom focused and they just need something to help right now. Like, they're not worried about, I don't want to talk to anybody about my feelings. I don't care about what happened when I was in the 3rd grade. I need something, and I need something now. And usually the first thing that comes up for people is medication. And I'm okay with that because I'm here to meet my patients where they are when they get to me. And often that's the dire situation that they're in. All right, I'm going to meet you right where you are. Let's deal with you right where you are. But then once we can get to the point where we've kind of put the fire out a little bit and things have kind of calmed down, I definitely circle back around to like, okay, what can we do about going into therapy so that we don't end up back in this situation where the house is on fire again? And often those are great techniques that you work through therapy, whether it's working through your trauma, working through how you manage stress, working through making sure that you're putting time into self-care, which I think is often missed because we just go, 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 go. And we live in a society where that's encouraged. Just go, 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 go. Well, we have that joke where it's like, oh yeah, I'll sleep when I'm dead. Just go, 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 go. And it's like, well, yeah, no, you really need to prioritize self-care. And self-care looks like a lot of different things. Eating, exercising, meditating, who you're spending time with, how you're spending your time, not too much of this, not too much of that, everything in moderation. So all of those things are important and they all feed into positive mental health and well-being overall.